Good evening to everyone in the physical room and those that are hopping into the Zoom room. My name is Mallory Van Abema. I'm the Community Opportunities Coordinator here at the City of Shoreline. And a great pleasure that I have in my role is to be able to help facilitate these monthly sessions focused on a variety of issues and or projects happening in our community. And tonight we are focused on human services broadly, but drilling in and focusing more specifically on crisis response and behavioral health services in the City of Shoreline. So we're really pleased to have our partners at Shoreline Police Department here to present alongside another partner who is here with the Regional Crisis Response Agency, or RACER. And then you're going to hear from folks who actually deliver behavioral health services in our community and are key partners in delivering these critical services to residents and in and around Shoreline with Center for Human Services. And then we're also going to be having an opportunity to hear a personal testimonial of someone who has had an interaction with law enforcement, which really changed the trajectory of their life. So we're really excited to have that story to be blessing us this evening. For folks that are joining us on Zoom, please do keep yourself muted until we get to a point where we are doing some question and answer. And we will ask that if you have questions that you'd like to ask our presenters throughout the evening in the room, raise your hand. We'd like to get you mic'd up so the folks online can hear you. Folks on Zoom, please raise your hand using the functions at the bottom. You have a react button at the bottom of your Zoom room. Click the heart and you'll see a little raise hand icon. That's how you can let us know you have something you'd like to say. You can also drop your questions directly into the chat box, which is also on your bottom bar of Zoom. We typically host these events on the fourth Thursday? Are we on the fourth Thursday? Third Thursday. Fourth Thursday. Are we on the third right now? I think it's the fourth. Oh, it is the Typically, we will be hosting Sitting Learn events here in council chambers every month on the fourth Thursday of the month. And the only months that we don't host those events is when we have kind of high season other activities going on, such as July and August when the summer events are happening and there's a lot pulling us in other directions as far as city staff goes and programming. So we hope that you will come and join us for the February session focused on the shelter system at the regional level, navigating that and better understanding it. And then March, we are going to be diving into a topic that is really complicated, and it is immigration. We're going to try to better understand the immigration system and how it's functioning and or not functioning, and try to get the most up-to-date information on immigration in Washington State. And that'll be our March City Learn session. So those are scheduled. You can register for them now. Please do. And thank you for being here. With that, I'm going to pass things over to John and Captain Woodruff to lead us off directly from RACER, the Regional Crisis Response, and Shoreline PD. You guys have your microphones at the table. Let us know when you'd like slides advanced.
So we don't have the clicker? Okay.
No, sorry. Yes.
So I have to look up. So I'm Captain Neil Woodruff. I'm the administrative captain here at the Shoreline Police Department. So happy you could all join us in person and online.
My name is John Strymikes. I work for RACER as a crisis responder. Wonderful to see all of you here today as well.
So we're going to be talking about the Regional Crisis Response Agency. Go ahead and go to the next slide, please. So this actually comes full circle for me. In 2016-17, I was actually a patrol deputy here. I actually worked for the King County Sheriff's Office. We started a program called Radar, and my job was, since I came from training, was to set up training for that. And then it was in an attempt to bring the community and the police closer, especially when it was crisis type type things. And that's how I became involved in this. Coming full circle, now, next slide. We're piggybacking now off of, and so our deputies, this was the idea of the radar program was to base it off of what we required our deputies to go through. The state required our deputies, and the Shoreline Police Department was building an extra training, so it was helping the community out. With that, in 2023, Racer got formed with the contract city of Shoreline, Kenmore, and then Lake Forest Park, Bothell, and Kirkland.
So as you're probably aware, there are a number of behavioral health crises that result in 911 calls. Police officers respond to those crises as best they can, but they often don't have specific skills and training to understand maybe what is going on, how a person could be best served, how safety could be best served. And they do a fantastic job understanding people from various walks of life and different types of trauma. However, there are certain skills that someone with training as a mental health professional could add to that equation. So they already do pretty robust training for all police officers, but the decision was made to start creating this force of social workers who would be embedded with the police department. There are a couple of different models, different ways to approach this issue. Those could be sort of summarized as alternative response and co-response. The alternative response system is when someone you love, a family member, a neighbor, someone you see on the street is having a behavioral crisis and you feel like no police is needed. All we need is someone to talk to this person and connect them to resources. And in that case, the 988 system has been developed, the mobile crisis team has been developed, so you can get a no police force response of trained professionals who will come out and try to help any situation. When there are factors that create risks to safety, when that person who's in crisis is also brandishing a weapon, or has broken a window, or has made threats to harm themselves or others, credible threats, suddenly there's a call for police to be present. And my job with the Racer program is to attach to those calls as well, arrive with the police officers, and offer my particular expertise, whether that's in de-escalating a situation, knowing what sort of resources could help a person. Sometimes it's as simple as presenting a different sort of front. When someone's in crisis, Neil, if I can borrow you here for a second, I'm just going to take you as a volunteer here. When you're in crisis and a man with a gun strapped to his hip and in a uniform approaches you, it can be an intimidating situation.
Especially when they're a lot bigger than you.
And they might be very tall and looming. And there's a couple of things that I do that are different than what Neil can do in a situation like where you're having a crisis. The first one I kind of joke about is I'll sit down on the ground. Police officers, I've literally never seen a police officer do this. I do it constantly, and part of it is to remove that sort of I'm looming over you and I'm a power and authority figure. Instead, I just want to talk, okay? And I'm willing to sit here with you and be in a more vulnerable position instead of having to make sure that everyone stays safe. But what's great about me doing this is I know I've got him here behind me. So if anything does happen, if I'm suddenly attacked by you, I've got backup and help, right?
And that felt safe with you just sitting down.
It changed the way you felt just now, didn't it?
Exactly.
It's amazing how that works.
So the de-escalation, the problem solving, the resource finding, the warm handoffs, the sitting with someone while we wait for the ambulance to come. Often I'm educating them on what to expect when they get to the hospital, how the social workers are going to need to interview them, what sort of questions they should ask in order to get the resources they need before they get discharged. So that's kind of a summation of what Racer does, why we're working with the police department, why we are embedded with them as opposed to doing an alternative response because of that value added.
So, next slide.
So the quick summation of the goals of the RACER program are to be available to provide this crisis response, to reduce overall the number of police responses to behavioral health crises out in the community. We provide alternatives to police as primary response to crisis. And to be clear, a number of 911 calls go directly to me and my team. So a police officer doesn't necessarily need to respond. And that's usually if it's someone who's known to us or somebody where what they need is a telephone call. But if I'm going out to a house of someone or an apartment or on the street somewhere with someone I don't know, I will always have a police officer with me. And that police officer will be responsible for two things, first of all. One is to make sure if there is a crime that has been committed that they can investigate that crime. Two is to make sure that there is safety in the scene, that there is no one who's currently at risk. And so I always wait for my police partner to make sure of those two things, and then they'll give me the look, which means, this is your field, not mine. Take over, please. And then I'll come in and start the interventions. So with that in mind, what we're really trying to do is reduce the strain on police and fire departments. We can reduce some of those repeat calls, and also when the officers go out, they're trying the best they can, but these things are complicated, and when it's not your field of expertise, it can be very challenging for those police officers. So they're always pretty happy to have me take over on those. If you go back for 1 second, I do want to call out the partnerships. When I started in this position a couple of years ago, I wasn't quite sure who I would be partnering with out in the community, who were the important agencies that I would be collaborating with. For example, I learned that schools are often fairly uncomfortable having armed police officers come onto the campus and talk to students. But schools also deal with behavioral health crises, where a student, the other day I was at Inglemoor High School, 13-year-old trans male student made some suicidal comments to a friend. Myself and officers showed up. All the staff were incredibly nervous about having police on campus, but suddenly they welcomed me and said, oh, please come in, please talk, please find out what's going on with this kiddo and whether or not we need to go all the way to a hospitalization approach, or maybe there was a less restrictive alternative, which is a term that we use in the mental health field today. Basically say, instead of taking away someone's civil rights and saying you're going whether you like it or not to a hospital and you're going to be strapped to a gurney, maybe we can talk, maybe we can get parents involved, maybe we can get a therapist involved, maybe we can make sure there's a safety plan and we don't have to go that route where anybody puts hands on or risks traumatizing somebody. We've often, I just came from a call about 45 minutes ago where one of the pieces I was able to add was this gal who's going to be going to Northwest Hospital in an ambulance. I called ahead to the hospital to give them a heads up, and my recommendation that what this person probably needs after a thorough medical examination is to be referred to the Crisis Solution Center, because she's new to the Seattle area. She doesn't have any resources in place, no disability benefits, multiple diagnoses, no medications, no mental health case management. And the Crisis Solution Center would give her a place to be for a few days while the social workers and specialists there can help connect her to a lot of these different services. Also, you may know this about at Shoreline, there are a great number of adult family homes, and these adult family homes provide housing and case management and on-site assistance for folks who are living with some sort of disability, and they are often overwhelmed by the clients that they are serving, which results in 911 calls. Sometimes we have clients that call 50 to 100 times a year, and this takes up a lot of the police resources to respond to those calls. So our RACER, as a team, try to take those off the police's plate, because there really isn't anything the police can do in those situations, and the person may just need half an hour of emotional labor. Really just someone to sit and talk and listen to them and encourage them and make them feel like they're not alone and someone's listening and hearing them. And that validation is what they need to be okay and get on with their week. And if we can do it instead of a police officer, that's a win. There's a few acronyms up there. The RNP, that stands for the Recovery Navigator Program. This is a fantastic program that comes out in teams of 2. They are all peer counselors, that is people who are in recovery themselves from some form of addiction. They help us so much with anybody who wants help getting into treatment, anybody who wants to go to detox. They can pick people up, get them to a shelter or a hotel room for the night and into detox tomorrow. And they follow up. They call me the next day and tell me how it went and what the next steps are. I'm so grateful for them as partners. We also work with the Mobile Integrated Health Team. They kind of are like the racer team, but they work with the fire department as well. Lake City Partners, LCP. They do a wonderful job trying to provide housing case management because everybody knows homelessness is one of the most impacting issues that our community is dealing with, and the folks that are having behavioral health crises that also are experiencing homelessness and possibly addiction issues on top of that, it becomes very difficult to make any headway because whatever problem you try to address, the other problems can sort of pull the person backwards. So Lake City Partners, who run the Oaks Shelter, God's Little Acre Drop-In Center, they've been wonderful partners. They call us out directly sometimes when Racer can help them de-escalate a client at the shelter. When we refer people into their shelter, we always follow up with them and track the progress and continue to try to help that person make it on their journey. We also work with the Corrections Department. I've visited people in 3 different jails since I started this job, so that if a person does have to be arrested because there's a warrant for them, for example, like it may be that the person's ready for help, they want to get into treatment, but they have a warrant, so they're going to go to jail. Well, I can go to the jail and visit them and talk about connecting them to treatment straight out of jail. So Corrections has been an important partner. And then the city of Shoreline has a code enforcement team and community outreach teams, and they encounter a lot of Shoreline residents that are struggling and need behavioral health care. And they will refer to us, and we'll partner together to try to work with those folks. Thanks for letting me go through all that. Our organizational structure is built around the idea that we have 4 full-time crisis responders, and we split the week in half. So I work Wednesday through Saturday. The other team works Sunday through Wednesday. So we cover 7 days a week. It's not really 365 days a year, though, because we take holidays and vacation day. But the idea is to try to get 7 days coverage from morning till night. We already talked a little bit about the difference between co-response and alternative response. We are definitely part of the co-response system, so working with the police as our partners. Some people are curious about how we're structured. There is an executive board, a principals assembly, operations board, and a community advisory group. That last one, the community advisory group, is something that some people have asked for more information. There'll be a slide at the end that has the contact information for my big boss, Brooke Bittner. She runs that group, and if anybody's interested in bringing their lived experience to an advisory board that helps inform how Racer operates, that's a great opportunity to volunteer and get involved. So this is just an ad for the community advisory group. I know that one of the members of that group is pretty active at the Tuesday resource fair that happens here at City Hall. I just think it's so important when part of the mission of Racer is to work with the police department and rebuild public trust between the community and the police, that we are listening to the voices of people who are impacted, that they have an important say in how we're going to operate, how we're going to interface with the police, ways in which we're going to stay separate from the police department, to maximize our credibility and to continue to work on this idea of rebuilding public trust. There are some interesting bits of data that are tracked by King County. King County tracks every single person that Racer has any kind of a connection with. When I go out and I see someone like I did an hour ago, that client, it goes into a database. King County does some person tracking where they look at that person over the next couple of years and see how often that person has repeated connections to law enforcement and to mental health services. So one of the outcomes that they found is a 68% reduction in adult jail bookings for people that are working with the Racer team and alternative sort of behavioral health responses. And in the next slide, a 48% reduction in crisis service events and a 44% increase in accessing and utilizing mental health services, like the folks that are going to present later, the Center for Human Services. I cannot tell you exactly how that data is figured out, but if you're interested, you can always look up King County's MIDD program, M-I-D-D. That stands for Mental Illness and Dual Diagnosis Services, and they do a tremendous amount of gathering and tracking data to try to figure out how to best serve our community.
So in Shoreline, our police department, our Racer people are actually in our front office. They are co-located with us. We contacted 562 individuals in 2025. The total number of contacts, though, was little over 11,000 or 1,100 contacts, and with the average of that being two per person, contacts, but in all reality, one client actually got 20 contacts from Racer.
Well, the slide says 2026, but that's actually 2025 data.
Yes. So when you're looking to this at these numbers, 217 different contacts were referred to at least one of the other services. So Recovery Navigator, Lake City Partners, et cetera. Of those 1,100 contacts, 419 were these guys actually attaching themselves to the call. They are monitoring our radios. They've got our radios.
Actually, that was one of the hardest things to get used to in this job, is carrying a police radio around and listening to every single thing that's happening in this community and several other communities, because they're sharing the same radio. But we all have a unit number. I'm Adam 92. I'll get on the radio as soon as I hear that there's a suicidal subject calling 911 saying that they've overdosed. I'll immediately get on and say, Adam 92, please attach me to that call. And then I'll get in my own vehicle and join the police officers there.
And then 56 were directly dispatched to the Racer unit. 197 of those officers requesting a Racer unit.
And this is a wonderful thing that happens. So 200 of those referrals, I see that hand up too, came from a scene where officers went out. Maybe it didn't seem like it was going to be a behavioral health crisis, but when the officers arrived, they determined, I could really use a Racer unit backup. So they'll just get on the radio or call me, and then I'll attach and come out. Let's go ahead and pause, because I want to make sure we get questions in instead of, and I'm going to bring you the mic so that they can hear you online.
Just a little clarification from something you said at the beginning and you're kind of getting back to now. You said there was a 988 number they could call for services or something like that, right? Or they could call 911. Maybe I'm not understanding correctly. It seems like then the general public is kind of making the decision who should be called, and it seems like more like a trained dispatcher ought to be making that call. I guess that's my question.
That is a great point. There is a public campaign happening to try to educate people about 988. It's a fairly new system. A lot of people have not necessarily heard about it or understand what all it entails. You can always call 911, and the dispatchers and the call receivers will figure out the best response. However, there are some members of the community that do not want to work with 911 because they don't trust 911. Maybe they've had bad experiences. They're afraid for their child. They don't want police coming out because they see that their child is yelling and screaming. Maybe they've said they want to kill themselves, and the last thing they want is a police officer coming with a gun on their hip to talk to that person. So we are trying to help people understand better that you can call 988, and if the person is not representing a real risk to anyone's safety, those call receivers will figure out if a mobile crisis team could come out and serve that family's needs better than having police and a co-response system to come out. Now, the 911 call receivers can also funnel calls towards that outcome if that's what the person says they want and it seems indicated, and vice versa. There are people who start with 988 and they feel like that's what they want, but then the situation escalates. Maybe they're talking to the person who's in crisis directly and they say something like, well, you're not helping me, I'm done with this, I'm just gonna take the pills, goodbye, and they hang up. That 988 call receiver can't just ignore that at that point. They have to kick that over to 911 and then we'll go and perform a welfare check. So you're right, it is an uneasy thing that members of the public, rather than trained professionals, are sometimes deciding which direction that call is going to go to start with. But just because it started one way doesn't mean it can't go the other.
We have one question online in the Zoom room. So Susan has asked, I wanted to know if Racer and the police are trained to work with teenagers or kids who are neurodivergent, have autism, ADHD, et cetera.
So yes, we are. We actually have, by state standards, we actually have to attend a 40-hour CIT training, which is crisis intervention training, but we also go through refreshers for 2 years online. And one of those trainings was dealing with autism and the spectrum disorder, and we take that very seriously. So, and actually the whole radar program was based off of, hey, get the information. Like one of the specifics of that was, hey, my son has autism, he likes trains, he looks like he's a very tall individual. Just come up and say, hey, how do you like trains? And that was added into those notes, and that was the idea of the RACER program, or the radar program initially.
I would just add that there are always going to be specialists that know more than the social workers who work for RACER. We have a broad basis of experience. I've been a case manager, I've been a therapist, I've been a designated crisis responder for King County. I was the first manager at the Crisis Solution Center when it opened. So I've worked with a broad variety of clients with mental health disorders, with substance use disorders, but I am not a specialist in one specific group of people. So we are often looking to, because I can't be a specialist in geriatric dementia and autism and substance use disorders and schizophrenia and everything else, PTSD and sexual assault. But what I can do is have at least some training and understanding of all of these different groups of vulnerable people, and then the humility to get them connected to the specialists who can provide ongoing services.
Any other questions?
Nope.
No? Okay. So when we look at the numbers, we see 28 came from walk-ins in the lobby. They're just referred by our two admin people. 183 of these officers will refer them to RACER. They'll come in and they'll actually come in and they'll send the report over to them. But a lot of times, just having them in the building, they'll go in and talk to them about this incident. Say, this is what I came up. This is what I had. I'm not feeling comfortable with how this went, and what do you think? And then the RACER folks will offer their opinion and actually do some follow-up on that.
This is actually one of the more endearing things about our Shoreline Police Department is how many referrals come after they have done their job and they could just walk away and be done, but they felt like, I don't love how this situation felt. When I left, I was still worried about the person. John, could you check on them? Can you make sure that they've got the right services in place, that they're going to be okay? Just the other day, we had someone who had gone into diabetic shock, and police had to enter their apartment to make sure that they were going to survive, got them to the hospital, and they were okay. But they were a little nervous about that person coming back home and being on their own again the very next night, because they were alone, they lived alone, and their caregiver wasn't going to be there for 3 or 4 days. So, of course, I said, well, I'll just call and make sure that they're okay. I'll give them a call at night about 9 o'clock at the end of my shift. And then the officer said, and I'll follow up the next morning. And we followed up twice with that person, and they started to feel a little more confident that they were going to be okay. And there was no crisis with that person ultimately, except that they felt very vulnerable and scared because of what had happened to their health, and that they had needed a crisis intervention. And I just thought it was a kind of a beautiful thing that that deputy cared enough to say, even though we're done, let's make sure this person's actually okay.
226 were, of the over 1,100 were follow-ups conducted by Racer after the initial contact, and the remainders are just miscellaneous. I can't stand that. There shouldn't be a miscellaneous tag, but there is, so it just is.
There were a couple of success stories we wanted to share. Unfortunately, this one means I have to brag for a second because I am named as the RC member. This was written about me by one of our deputies. This was about a 13-year-old subject. We went to their house. They had texted friends that they had been thinking about killing themselves. And we went to the home, and the 13-year-old was terrified of the police officers. Came out onto the porch and then immediately tried to go around to the side of the house and would not say anything. And I asked, first of all, I sat down on the ground, because again, that's a really useful tactic for me. And I asked, if the police officers backed up, would you be willing to talk to me? And he nodded his head. And that worked incredibly well. The police officers agreed, as long as they had eyes on and could make sure that everything was safe, they would back off. So they went across the street and just watched. And I sat down and talked with this young person. So Deputy West and Master Police Officer Rodriguez gave me some space. I talked with the subject alone for a little while and found out that the person was actually already heavily connected to services, saw multiple therapists every week, was going through hormone therapy, was going through the 13-year-old first heartbreak of getting dumped, and had definitely had thoughts of killing themselves. But it was not going to help to pull this kid away from his mother and his grandmother in their home and send him to the hospital. What the kid needed at that time was for parents to be aware that they were really struggling and they needed some extra support and some eyes on, and then to make those next appointments with the already existing supports that were in place. So we were able to leave that situation with a much more nuanced and happy ending than if, many of the police officers, what they are trained to do is when they hear the magic words, the words that the person said, I want to kill myself, well, they only have one tool then, which is to call for an ambulance and send them to the hospital. And that's really not helpful for many people. It can even be harmful and traumatic. So trying to come up with better solutions on the fly like that is one of the things that we're excited about. It happens every day. And those two officers were fantastic to work with on that scene, mostly because they backed off and let professionals handle the situation.
Hi there, Patty Hale. So I understand that this has been the case for years, that the #1 call for service for the fire department is for these group homes and senior homes that we have. And I wonder at what point may or may not the police and Racer also work in conjunction with the fire department, because they face the same situation that you do. They may or may not need medical help, but they are in crisis.
Thank you for that question.
So they actually do have a similar program to RACER, and they actually work in conjunction, but that is more for the medical side of things, not for, hey, somebody's in crisis and we get called to them. That's the difference. But we do. I know RACER works with them, but it's not a one-for-one. It's if they get called to the scene for a medical thing, but it's not really a medical thing. It's more of a.
Yeah, we love the mobile integrated health program. They're the ones who work out of the fire department and do a similar type of service. I call Annie over there every now and then when I've got a client that is, police are called, I come out and I find out maybe there's an isolated senior who's beginning to have significant dementia. They're getting lost, they don't know how to get back home. Someone at a store finds them, calls 911, police figure out where they live and get them home. Well, now what? Because that's just going to happen over and over again. And so we've got to try to get family involved and other professionals. And those folks with the Mobile Integrated Health Program are fantastic. They really try to track all of those folks and continue to check in on them and make sure that they get connected to some services and supports. It's not perfect, and that really is a significant issue because many people don't have the insight that they could benefit from help and services. They feel like, oh, I've lived alone. I'm more comfortable that way. I don't want any help or services. And that can be really frustrating.
And we have one question online. Diane has asked, how similar or different is this program, RACER, from Seattle's CARE team or the CARE department? If you're familiar.
Seattle has a few different programs. I believe that the CARE team is an alternative response model. And if you were to call 911 within the city limits of Seattle, one of the options could be that the 911 dispatcher determines that this is a call more appropriate for the CARE team. And they work, I believe, in teams of two with their own vehicles, and they go out kind of like that mobile teams that we were talking about before that can serve the whole King County, but it's for Seattle specific. Mm-hmm. So they're a little different. They're not an embedded police program. They're a separate dispatched program. But Seattle also has co-response teams that are embedded with the police departments as well. I'm not sure if that covers every precinct within Seattle or not. There may be only certain precincts have a co-response embedded with them.
Yeah, and they're also riding along in the police cars. So so our co-responders actually come in their own cars, and so they can stay on scene if they feel safe. If we've deemed that, hey, this is not a, there's no immediate need for safety. There's nothing that's going to hurt them. We can leave, and they can go follow up and use their own cars to do that. So, go to the next slide.
Another success story. Deputy Sarah Lacey, who is amazing. I want to just point out.
Yes, she is.
She and mental health professional Emily Evans, that's one of my coworkers with the RACER team, responded to an area check on the interurban trail. They stayed with the man who's experiencing homelessness. They decided to refer him to the Recovery Navigator program. So this man acknowledged that he had a fentanyl addiction issue. And probably you're all aware that fentanyl use is an epidemic. It's replaced all of the opiate addiction that was very common 5 to 10 years ago. And it's an incredibly dangerous drug because of how many people die of the overdoses. It's an awful problem, and there is a lot of help if anyone wants that help. So we called the Recovery Navigator program. Now, one of the biggest problems in the whole social work system, many people like to point at social work and mental health and say, the system is broken. Has anyone ever heard that before? The system is broken? Well, one of the reasons for it to be broken is how many people slip through the cracks. And one of the best ways that people slip through the cracks, or one of the worst ways, really, that people slip through the cracks, is when it comes to handoffs and referrals. So rather than just call the Recovery Navigator program and say where this person was located and then leave and hope that the person stayed there and accepted the help, they sat there and waited. And sometimes we might wait 30, 40, 50 minutes, an hour for those people to come who have those resources that are going to be life-saving for that person. And then Emily just also wrote this quote, Deputy Lacey treats everyone she encounters with respect and dignity, regardless of what they're going through. She is dedicated to community members getting help and bettering their lives, and I am lucky to get to work with her. We're hopeful that this gentleman gets the help that he needs. So I love these stories when people actually spend that extra 50 minutes instead of saying, oh, I'm busy, I'm off, I got to go to the next call, or I need to go get lunch or whatever. But sitting there and making sure that handoff happens is wonderful.
And this is one of our goals. The chief has said, make sure you take care of the people. Deal with your call. You can move on to the next one, but make sure the call gets followed through on.
Another success story is about a gentleman named Clyde. Clyde had been living homeless in Shoreline for years. He was familiar to many deputies due to the various crisis events. Clyde suffers from some behavioral health issues, as well as some substance abuse issues. And he was often seen flying a sign along Aurora. But sometimes when 911 would get called, it would be because he had fallen down and was thrashing around in a public bathroom, naked, having urinated everywhere, and out of control, not doing well, in a clear crisis state. So Clyde, initially we referred him to get into the Oaks shelter with Lake City Partners. And while he was waiting for a placement there, he didn't have a phone, or he kept losing his phone, so we couldn't get a hold of him very easily. Lake City Partners called me and said, hey, we've got a spot for him. And I was trying to find him anywhere to get him into that shelter bed. And while I couldn't find him, one of the officers, Deputy Shetler, he let me know that he had actually involuntarily detained Clyde earlier because Clyde was sitting in traffic on Aurora protesting the medical system, which turned out to be exactly the information I needed, because I knew where he was now. He's at Northwest Hospital in the emergency room. I know how to call the social workers there, and I know that those social workers want to figure out how to discharge him somewhere safely. And so I was able to tell them, please coordinate with Lake City Partners. The staff at the Oaks have a bed for this guy. If you can get him there, he will have a shelter for the first time in years. And they did. They called Lake City Partners. Lake City Partners let me know, this is great. We're happy to, we'll do the intake for Clyde. All he has to do is just arrive here. So the ER social workers got him a taxi and delivered him to the Oaks, where he managed to stay successfully until he was placed into long-term permanent supported housing after about a month of being at the Oaks. There are so many ways that a success story like this could have fallen apart, because people didn't want to coordinate care across systems, because some service providers are bound by HIPAA and can't really communicate with other providers. Luckily, there are some provisions within HIPAA where if you're coordinating care for a person in crisis, you can sort of set HIPAA aside. So that was a fantastic success story, and it was very just serendipitous that Deputy Shetler knew who Clyde was, knew we were trying to find him, and let me know where he was. This is one that's a little emotional. Not because of a bad ending, though. Probably a little, there's a 65-year-old woman. She's been homeless for years, living in Shoreline. She's confined to a wheelchair. She has serious knee injuries and chronic pain, and she has a very difficult personality. She has made many people say they never want to see her or talk to her again, because she swears at people, and she constantly says, no one's ever done anything for me. I am going to drive my wheelchair into traffic, and you'll never see me again. And many officers had no choice but to send her to the hospital in those circumstances. The hospital looked at her and said, well, there's nothing we can do for you. You're not schizophrenic. You're not bipolar. You don't need medications. So they would kick her out again, and she'd be back at square one, sometimes sleeping in her storage unit, sometimes sleeping on the street. And it got colder and colder over this winter, and we were trying to figure out how to help Erin. And we did finally get her into the Oaks shelter. And that was victory number one, and we were very proud of that victory because she had a place to be, and then we could start working on the medical issues and maybe some long-term housing. Long-term housing actually did come up because her case manager through DESC SAGE's program got her an apartment approved through Compass Housing. So this meant that SAGE with DESC is talking to Compass. We're talking to all three of these partners. Our City of Shoreline Community Outreach staff were also involved because they were storing some of her belongings after she got evicted from her storage unit. So we had about 6 different agencies looking out for this lady and trying to figure out how do we keep her alive long enough to get her into permanent housing so we can begin to address all of her various issues. There were definitely some things where I felt like, well, I am just going to pull my wallet out and deal with a certain situation. Like she couldn't afford the $8 to get the opiates she needed she finally got her prescription for her medicine for her knees, but $8 was the barrier. And the police department has occasionally some funds available to them to handle things like this, to just solve a problem and make it go away. What is that called again? The Blue Fund?
Blue Bridge.
Okay, Blue Bridge.
Yeah, Blue Bridge.
And it's a small amount of money that's available, but officers have their discretion to occasionally invoke it to help a situation like this. So we got her medications. We had to hospitalize her at one point, just trying to buy time so she could get into this housing because it's only till Tuesday, and here we are on Friday. Can we get her to Tuesday? And one of the hardest things that I remember having to deal with last week was having no options. Because she was confined to a motorized wheelchair, there were various crisis centers, various hospitals that basically would not accept her. And that is a terrible problem that probably needs to be addressed at a big systemic level, because when the alternative is, I'm sorry, we can't serve you because of liability issues, you're in a wheelchair, you can't transfer yourself to toilet or get into a bed, so we're not going to serve you, which means the alternative is you get to sleep on the street. So a 65-year-old lady in a wheelchair is sleeping out in the freezing cold. So that's a frustration. But anyway, she did manage through a huge amount of her own fortitude and a lot of different people packing help around her to get to that lease signing. She signed her lease. I got back to work on Wednesday, found out that she'd survived and she had signed her lease and moved in, called her immediately, and she told me she loves her apartment. And this is a person who does not say positive things. So when she said she was excited and happy that she loves the people, she loves her new apartment, it was just...
So basically, she expressed her gratitude for Shoreline Police Department, but most importantly for our racer and our other partners that we, because she just felt hopeless and defeated and didn't have to anymore. So.
And I can't even tell you how many cops she told to go to hell. I don't ever want to see you again. You did nothing for me. And those police officers all stayed patient and calm and kept their eyes on the prize, which is, this is a lady who needs help. And she's just expressing anger because her situation is messed up.
Right.
I'm just going to do a really quick time check because we need
Yeah,
to
no problem.
transition pretty soon. So we want to hear
Absolutely.
these stories, but you might have to fast forward.
I think this is one of those ones that we have deputies that recognize that people need help, and so John and Emily responded to this welfare check with Deputy Hanley and Deputy West. They were able to, John and Emily were able to complete the referral to the Recovery Navigator program and get them immediate resources. The whole point of this is that when we go out, the police department, we can actually step aside and say, hey, let them take the lead. we can step back and we can get them into more long-term supportive housing, and it can't be done without racers' help. We couldn't do that without them, and that's kind of the point of this story.
You probably have all heard about sweeps that happen, especially in the Seattle area, where people who are living in parks on the side of the street, in tents, doing the best they can but struggling, are often just moved along. Police come and say, hey, you're disrupting the people who want to enjoy this park, you're disrupting local businesses, you've got to go somewhere else. And unfortunately, that doesn't change anything. It doesn't fix anything. It just pushes the problem down the road a few blocks. So one of the things that is really great is when we can find a different solution, when we can say, instead of just pushing this person down the block, what if they're ready to talk to someone about getting treatment for their fentanyl addiction, which is contributing to their homelessness. And if we can ever do that, we jump on those opportunities.
Whoops.
So our last slide is contact information for my executive director, Brooke Bittner, who's a great person if you have any follow-up questions about Racer. If you're interested in knowing more about the community advisory group, she welcomes anybody's emails at that email address.
And that's my email. You can send any questions that you have for the PD to me. Also, John brought up the Blue Bridge program. It's actually very well funded. It's the Shoreline Police Department is actually got the most money. We've got over $4,000 and we have debit cards for our officers, and we deploy those, and if they see somebody in need that needs that immediate address, we can give them $10, $15 of whatever service they need. So and it's all funded by Shoreline residents or outside donors, and it goes straight to the Shoreline bank account.
And a final word that I want to say is, I know there's some debate going on at city councils level across all of King County about, is it a good idea to have crisis responders working directly with the police officers or not? Maybe those social workers would be more effective or more credible if they were separated entirely from the police department. And I guess my response to that is, why not both? There's room for both. If anything, we need more behavioral health interventions and services in this community, not fewer. We shouldn't have to choose between, well, this one has strengths and that one has strengths. They both have wonderful strengths. I make an impact just by being there on how police officers comport themselves when they go out to behavioral health calls. They want to impress me with their ability to work with people and de-escalate situations. They show off to me all the time how good they are at doing counseling sessions, and it makes me so happy. Afterwards, I'll sit and debrief sometimes with a police officer and tell them, like, wow, that was amazing. You do better social work than like 50% of the social workers I've ever met. Because they really do take it seriously. They try very hard. They take the training seriously. And I've felt incredibly empowered and rewarded in this position. I've had a long career in social work, and this is probably the most exhilarating, impactful, and interesting job that I've had in my 27 years of being a social worker in Seattle.
Thank you both so much for this overview, the testimonials, all the work that you do. We so appreciate it. John, I'm going to ask you to come over and answer a question in the chat, but I want to move us forward so we can hear from a service provider that accepts some of those referrals that you all are administering out in the community. So please welcome Ara and Britton from Center for Human Services. If you wouldn't mind grabbing the microphones at front and letting me know when you'd like slides to be advanced, but I'll get you going on your first one. Thank you both for being here.
Hello, can you hear me? Okay, cool. All right. Thank you everybody for being here. Hello to everybody in the virtual Zoom land. My name is Ara L, she, her pronouns, and this is?
Oh, I'm Britton Stewart, she, they pronouns.
Yes, and we both work for Center for Human Services, and we are here today to present about like who we are and what we do. Next slide, please. So just to give a bit of a brief presentation overview, today we'll have a quick welcome and introduction, a little bit more about who we are, and then we'll go ahead and talk about our programs and services, the different locations we have and the different modalities we provide our services in. We'll talk about the communities that we serve, and lastly, we'll talk about how to refer our clients, and then I'm gonna take a second to talk about our core values and our philosophical approaches as well, and then we will have time for Q&A at the very end. All righty, next slide, please. All righty, so hello again, everybody. So my name is Aura L, she, her pronouns, and I am the Outreach and Engagement Manager and a mental health counselor at Center for Human Services.
I am Britton. I'm the Access Department Director at Center for Human Services. So a lot of what my department does is the welcoming committee whenever you're ready to come and see if we're able to help.
Yeah, and I just wanted to also share that Center for Human Services is dedicated to providing healing-centered engagement and being a trauma-responsive organization. And so just to kind of talk about those pictures up there, so if y'all are ever driving down on 15th Avenue and you see that big reader board, that is actually our 170th location. So it's kind of like our main hub, and pretty much all of our services kind of touch base over there in some way, shape, or form. So whenever you're over there, feel free to stop by. We also have harm reduction supplies available for our community members. So if you ever need a box of Narcan, you need information on resources, what have you, if we have it on hand, we are more than happy to provide it for our community members. And then I also wanted to share a picture of what our outreach tables kind of look like when we're out and about. We do like to be out in the community. That is a picture from Mariner Fest a couple of years ago. And you can see that's actually our Substance Use Disorder Director, Kathy Asada. And so we have a table and we provide Narcan, we provide information, resources. And during that day, we also provided some light Narcan training for our community members. So if you ever see us out and about between either county, please feel free to stop by and say hi. And more than happy to chat with y'all and provide more information. All right, next slide, please. I say alrighty a lot. I'm just gonna let y'all know that right now. Get used to it, it's gonna happen. So our programs and services. So let's begin by going over what CHS actually is. Like, who are we? So Center for Human Services is a community-based behavioral health and family support nonprofit. We serve North King County predominantly, so that's strip above Lake Washington. So you're looking at Shoreline, Lake Forest Park, Kenmore, Bothell, a little bit of Woodinville here and there. And then we go as far north as Everett, so South Snohomish communities. And so we have 4 departments that we provide direct services through, including our Access Department, which is really behind the scenes, which they are awesome. But we have those 4 direct service departments. So I'm gonna go over them briefly. And so we'll start with our Mental Health Department. And so mental health counseling, we provide school-based and office-based counseling for children, youth, and adults. That means that we offer guidance to individuals, couples, and families who may be navigating issues affecting their mental health. We also have contracts with several school districts in both counties where we have mental health counselors assigned to certain schools to provide therapeutic services directly to students. We're actually in 4 Shoreline schools. I cannot name them off the top of my head right now, but we are here in Shoreline, and we are also in a couple of different school districts across both counties. Next, we have our Family Support Department. So our Family Support Department provides non-clinical, free parenting classes and programs, and we offer a majority of them in Spanish and in English. And so this includes our Positive Discipline virtual classes, our kinship support groups, which I need to clarify, those are relatives taking care of their relatives' children. So a grandparent taking care of grandchildren, an aunt taking care of their niece or nephew, right? Sometimes it's the other way around. I just want to clarify what type of kinship we provide. And we also run an after-school program out of Ballinger Homes, just down the road, which is a King County Housing Authority community located here in Shoreline. Next, we have our Substance Use Disorder Treatment Department, so our SUD department, where we offer person-centered substance use treatment for youth and adults. That means that we provide assessments, case management services, and intensive outpatient services and outpatient programs, so outpatient. And as I mentioned earlier, we also offer harm reduction supplies for our community members, and we do meet all criteria for DUI assessments. And then lastly, we have our CBIS, Community-Based Intensive Services. I know that's a bit of a mouthful. So that department provides wraparound behavioral health services to families, youth, and children in their preferred location. So it could be in their home, it can be in the school, at a park, or it could be in any one of our main offices, right? What makes that program so unique is we go to you instead of you having to come to us. And so the two programs under that umbrella for CBIS is that WISE wraparound and also our infant early childhood mental health services, through which we provide that pre, peri, and postnatal support for parents, new parents, and also for their young children up to age 5. Once they're in age 6, then they go into mental health instead of IEC, infant early childhood mental health. So just to clarify, for those who are unfamiliar with WISE services, the wraparound services, the primary way that it differs from traditional mental health therapy is that the youth has a team that supports them. So instead of only having a therapist that they're working with, so like that one-on-one relationship, they can have a youth or parent partner, so they can have peer support, a care coordinator, a case manager, or even an external person that the youth chooses. And so just to kind of wrap this up about who we are, so CHS is licensed, of course, by the Washington State Department of Health to provide our clinical services. And we were also just last year recently accredited again through CARF International, which stands for the Commission on Accreditation of Rehabilitation Facilities. So we are very, very serious about making sure our services are the best that we can provide, and we're doing everything the best way that we can. And so before moving forward, I do want to also clarify what we are not. CHS is not a crisis stabilization agency, and we are also not a detox center, to kind of like clarify that, right? We are the folks who come afterwards, and we're the ones who are providing that longer-term behavioral health and family support for our clients. So I just want to make sure that everybody here is clear about what we are and the type of services and the level of care that we actually provide over here at CHS. And so next slide, please. Ooh, now I get to talk about our locations and modalities. I'm actually very excited about this because there have been some recent changes over the past year. So this is an overview of our main locations throughout King and Snohomish counties as of today, January 2026. So going from north to south, we have first our Everett location. So we go as far north as Everett, and that is our Madison location. It is one of our newest locations. We just moved there last year, and that's where we primarily provide those substance use disorder services for Snohomish County residents. And now going down south on I-5, next we have actually our newest location. We are located at the Linwood Neighborhood Center, which the grand opening is actually this Saturday. So if y'all can make it, please feel free. That is the Volunteers of America run Linwood Neighborhood Center, where we provide office-based mental health services. And this was super not planned, but just literally a few blocks down, less than a mile away, on the same street, we have our second Linwood location in the Castle building. And so this is our main hub for the CBIS department, so the WISE wraparound and that infant early childhood mental health. And that's where we house them. And so funny enough, again, very independent of each other, we ended up being just like less than a mile away from both locations. So that's really great. And so lastly, we have our Shoreline locations. So I showed that picture earlier of our 170th location. So we have our 170th and our 148th. And so the 170th location is our main hub as an agency. And it's where we provide our family support program. So that's where we run Kaleidoscope Play and Learn 3 times a week. That's also where we have our King County substance use disorder programs, and we also provide offices that can be reserved for office-based therapy, and it's also a landing point for our school-based therapists. And of course, I would be remiss to also mention that that is where our access department actually is. And so going down about a mile down the road, we have our 148th location, and that houses a majority of our administration staff, and we also provide mental health office-based services out of there as well. Now, regarding our modalities, like how do we provide our services? It is predominantly in person, right? So we mainly provide in-person counseling services, but now, and I'm going to say largely due to COVID and the advent of telehealth, we also have the option of providing those telehealth services as well. Now, of course, these offerings differ depending on the needs of our clients and by each department. But what I'm really trying to share is that we do have some flexibility when it comes to how we actually provide our services. We really try to meet our community members where they are at, and what would work best for them. Next slide, please. Isn't that a cute map? It took me a second to make that map. It's cute.
It is cute.
Anyway, so, all right. So now y'all are probably wondering, all right, so we figured out this is CHS, who they are, what they do, where they're at, right? So who do we actually serve? So we serve quite a few different types of community members. And so we work with a wide variety of different folks. So predominantly, we work with Medicaid-eligible community members. Now, we also accept some private insurance, and people do have the option of paying out of pocket if they want to receive services from us. So what I do like to tell folks is, hey, if you're even thinking of maybe I want to engage in services with CHS, please, please, please go ahead and contact us, connect with us, and give us a call. And the reason for that is even if folks are uninsured or underinsured or something might be going on with their insurance, you never know if we may have additional resources that could cover the services that they're looking for. It just really depends on the situation. We're not going to know what that situation is until y'all connect with us. But it doesn't hurt to give us a call. So also, we work pretty closely with individuals navigating different types of court systems, right? So we work closely with local mental health courts, drug courts, family recovery courts, community courts, and a gamut of other folks who are just navigating the judicial system and the court systems just in general. And so, oh my goodness, I completely blanked. Give me 1 second, please. That accounts for both counties. So we work with multiple courts, both in King and in Snohomish counties as well. And we also work with students. We work with students directly in select school districts and public schools. And so we offer those school-based counseling services at Everett Public Schools, Mukilteo School District, Edmond School District, Shoreline Public Schools, the North Shore School District, and we are in one Seattle Public School. And one thing I did want to also add is that we actually, so we're not in every single school, but I believe that in the Mukilteo School District, we're pretty much in every single school, and it's also very similar with the Edmond School District, where we are in a majority of those schools, and that includes elementary all the way up to high school. And then we also work with families, just families looking for additional resources. Maybe they're not there to actually get counseling or any type of clinical service, but they're looking for resources, they want to get connected, or they just want to build community. And so that really includes that parenting support and those early learning opportunities for children. And again, I love to mention our family support department. Again, that is free. Those are free services that we offer. And even for folks who are just curious, or maybe they need some supplies, we also sometimes have we have donations, we have clothes, if we have diapers on hand, we'll be more than happy to provide them. So again, we do encourage families and community members, especially with the young children, please stop on by if you're looking for something or you just need someone to kind of connect with, or if say you're new to the area, more than happy to help you and support you and connect with y'all and welcome you to the community. Next slide, please.
My turn.
Yeah.
So the Access Department is something that is new to Center for Human Services within the last year or so. And the goal of having the Access Department is to kind of streamline getting people engaged and involved with our services. Because as you've heard, we have a lot of different services. So my department is definitely your first stop to figure out how can we serve you best. Something I like to be mindful of, though, is just kind of asking for help, asking for services can be very intimidating, and it can be something that might be new for a lot of people. So I always say you can engage with us formally through our process that I'm going to describe, but you and family members or any referrals that you have are also welcome to engage with us informally. My door is always open at our 170th office, and I welcome people to come in and ask questions. questions. Ask about our services. Ask what it might be like to be in therapy for mental health or for SUD treatment. We're willing to sit with you and answer all your questions and try to help you get connected as best we can. Or if you decide we're not for you, that's okay too. I'm just here as a resource to be able to sit with and help people understand what we provide. So the first thing that you would do yourself or as a referral is just give us a call. At this number, they're going to get our admin assistant at the front desk at 170th, and then they will probably transfer you up to the access department. So that first person filters a lot of our calls, and then they're going to come in upstairs to us, and they will go to our wonderful screeners, Kyle and Diane, who are always asking, how did people know my name on the phone? And it's probably because I'm out here telling their name. So Kyle and Diane are really kind and warm and helpful. What they're going to do with the screening is just kind of get some intake information, a quick 15 minutes with you to know more about your insurance, to know more about what services you're looking for, make sure you're safe, and make sure that we're going to be a good fit. And if not, we might need to provide other resources for you. That's okay too. They can also do that in the quick 15 minutes. After the 15-minute screening, they're going to get you scheduled for an assessment. And an assessment is something that we can get you in pretty quickly. We try to aim for, 1 to 2 days. And that person is going to spend more time. That's going to be a clinician or a therapist who sits down and spends a few hours really going over your history, what's going on for you, and what kinds of services that you need. And our assessors are all very skilled, well-trained individuals who care so much about the community. So I hope that everyone will know coming in that you're going to be cared for, welcomed, and encouraged whenever you come into the access department. After you are deemed eligible and you have completed your assessment, that's when we'll get you scheduled with either the mental health department or the SUD department. We might make a referral down to family services or our school-based services, but hopefully we like to try and get that done as quickly as we can. So get you in for an assessment within a couple of days, get you scheduled within the week. That being said, sometimes seasonally, our availability or the availability of our providers does change. So you have to bear with us and give us some grace. But just know that we are working very hard to try and provide services as quickly as we can and to meet the need of the community. Sometimes we also have availability of different grants to support people who are underinsured or uninsured. That's also not all the time. But if someone calls and they're struggling to get funding for services, it's certainly an option for us to take a look and see what kind of grants are available to help them throughout that process. I think I covered everything for our department, didn't I?
Yeah, no, that's awesome. Thank you so much.
Check my notes and make sure. Yep. I think that's all. But if you have any questions or if you have referrals, feel free to give me a call, stop by our office, find me afterwards. I'm happy to chat.
Yeah, thank you so much, Britton. And yeah, I love our access department. It's really streamlined our processes and helped us get folks feel welcomed and connected with services much quicker. And so I did want to kind of close the loop. That's basically all our information on our programs and services. But I wanted to go a little bit deeper and share a little bit about our core values and our philosophical approaches as an organization. And so I did want to take a moment to share those because it is an important part about how we actually provide our services. It's okay, well, what's the values and ideals and approaches behind how we do what we do. And so I'm just going to go down the list a little bit. And so our first core value, and you can find these on our website. They are open and just check them out over on our website. So we model DEIB, diversity, equity, inclusion, and belonging, which means that we respect and embrace the diversity of our community and are committed to weaving that diversity into our programs, actions, and results. We provide accessibility, which means that we provide services that are easy to find, understand, and utilize. We champion collaboration, and that is internally and also externally with our community partners. That means that we do our best to foster collaborative relationships that promote creativity, innovation, and teamwork. It is not unusual to find multiple of our clients engaged in multiple different services all at the same time. So we demand accountability. Oh boy, do we demand accountability. There's usually some sort of audit happening somewhere in our organization, and usually pretty much all year. And basically that means that we assess and coordinate our programs and systems to assure that we meet high standards of service and care. We personify integrity, which means that we are turning this page, and I'm reading my notes. We value the strengths and assets of our clients, community members, and coworkers, and are honest, respectful, and ethical in our interactions. And then lastly, we do our best to have fun, because everybody at CHS is really passionate about the work that we do, in the same way that the racer team is passionate about the work that they do, right? And so we do our best to embrace the role for play in promoting a balanced workplace and a healthy community. And so regarding our philosophical approach, I know it's really hard to read at the bottom there, but it's actually right there in our tagline: building a stronger community, one family at a time. And so what this really means is that we believe that the best way to strengthen a community is to strengthen its members and their families, and we are not just talking about genetics or blood family either. We believe every single person in this community is part of a larger unit. And when you strengthen one part of that unit, you are strengthening the entire unit as a whole. And so that means that we do our best to be strengths-based, family-focused, client-centered, trauma-informed, and culturally humble. And we also believe in a holistic approach in how we provide our services, which means that we're trying to do our best to look at the entire individual and provide support to more than one area of their well-being. Like I mentioned earlier, it is not unusual to have clients that are engaged in multiple services at the same time. So for example, we have multiple co-occurring clients who are engaged in substance use disorder services, and at the same time they're getting mental health therapy. Or maybe there's a school-based counselor working with a school-based kiddo, and parents are in couples counseling, or they're engaged in a family support program. So that's very common at our organization. Almost like we're a one-stop shop for behavioral health and family support programs in North King County and South Snohomish. And honestly, it's one of the major strengths of our organization. We have been around in some sort of iteration for over 50 years here in the city of Shoreline. And since we have such a wide variety of programs, services, and scopes, that really means that we're able to support more than one aspect of our clients' healing journey. And that's really the purpose of why we're here in the first place. We are here to support the healing journeys of our community members, every client that comes in, every person who's looking for a resource, or any person who's just looking to come in from the cold and needs someone to talk to. And so that's what we are here to do. And next slide, please. We are here, and I just wanted to say thank you. Thank you so much for your time. Thank you so much for your attention. And we are open for any questions, any thoughts, or any comments.
Well, thank you, both Britton and Ara. We have one question on Zoom, and then we can maybe move to any questions that are in the room. So Bill has posed a question about proportionality. Can you estimate, so this is maybe a pop quiz, can you estimate the portion of the community that could utilize the services that CHS provides but don't receive them? What would change that? How can we get more folks to access CHS services?
Okay. How can we get more folks to access CHS services? I think the best way of doing that is getting the word out there. While we have been around for over 50 years, there's a lot of people who live in this community who don't actually know that we exist, right? Nonprofit world be nonprofiting, right? But we are doing our best, especially after post-COVID, to get ourselves out there, to take opportunities like this as City Learn. So I think the best way is to get the word out and let people know that, like Britton said earlier, even asking for help is so difficult, right? That first step, the minute someone reaches in, comes inside, even thinks about looking for services, we want to get them hooked and we want to get them engaged, because it takes so much just to get to that point. So getting the word out, letting people know that we do exist, that you don't even have to have a clear idea about why you want to engage with us, just take an opportunity to do so. And then also us having this great access department as the welcoming committee to help hook people in that peak of engagement when they first ask for help is like one of the two ways, the two main strategies that we're utilizing at the moment to try to get more people involved. Britton, is there anything that you maybe want to add to that?
I was thinking about his data question. I'm not sure. I wish we had data on those things. But we definitely are a data-oriented organization, and we do look at numbers as often as we can. I think something else that we are doing as an effort with the Access Department to reach more people, to encourage more people to get engaged, is saying things like, our building is open to the community. Just come in and see like what resources we have. We have snacks, we have Narcan, we have a lot of resources. Just come upstairs to my office and just ask some questions. Being a facility that allows the community to come in and flow through and just see what we're about and what we have available.
Other questions in the room?
Not a question, but a testament. So my husband and I have been now married over 40 years, but CHS saved our marriage. We went to counseling while I was running for public office many years ago, and it was the only time we saw each other. Our counseling sessions were date night. And it is what kept us together, because it was our one opportunity to talk to each other over about a 12-week period where he was working full-time, I was working full-time and campaigning. He'd drive up in his rig, I'd show up in my car, we'd have a session, and then we would both be back on our way doing whatever. So thank you, CHS.
Beautiful. Thank you.
Thank you for sharing that.
That got me. Thank you. Thank you. Thank you so much for that testimonial. We're so glad that we were able to help you and your relationship.
Have you felt this strain?
Oh.
Has CHS felt it? I thought I was yelling. Has CHS felt a strain in the last few years? Financial strain?
Oh, a financial strain specifically. I'm going to answer that with, I think in general in human services, nonprofit, and behavioral health, over the past several years, and I'm going to say specifically post-COVID, I don't think there has been one organization that has not felt some sort of strain in one shape, one way or another, whether it's financial, especially staffing, especially capacity, and especially with meeting the hugely evolving needs of our communities. So that's like a general statement. What I'm also going to say is we are a very strong and we are a very healthy organization. We are not going anywhere. We have an incredibly strong leadership team. To answer specifically the financial question, we have a very strong financial team as well. We really do our best to try to stay one step ahead and make sure that we are making investments in ourselves, in our staff, in our communities that strengthen us while also strengthening the rest of our communities. So like we are not going anywhere. And so that is one thing that I can wholeheartedly share with y'all, that as long as we are here, please come through our doors, please access our services, and that we are strong, we have a good foundation, and that we are very, very stable. We're not going anywhere. Britton, would you like to add anything?
Yeah, I'll just piggyback on that and say the leadership team's efforts that go towards grant writing is so powerful and has really helped us to be able to continue providing services. And those skills of the leadership team and the managers and members of different programs that write those, their dedication, staying up all night and following all the different grant guidelines, like we owe a lot to them.
Oh yeah, we really, really like lean all in. Like we really work hard.
Really quick, also, we have an online question, which is like a yes or no. Do you offer Narcan training?
Okay, so
Maybe not yes or no, sorry.
So, like, we don't have any official Narcan classes. That's the number one thing, right? But if someone's coming in and be like, hey, can you teach me how to use Narcan? Yes, we can totally show y'all, like, hey, here's how you use it, give you, like, a 101 primer. If you ever see me out in the community, I will always be there to provide, like, Narcan training, Narcan information, and what I like to call Narcan fun facts, and also, in general, actual Narcan, and occasionally, if I have them on hand, Narcan kits, which are a little bit more robust that we put together internally at CHS. So to answer your question is, like, if you come in, we can totally, like, do Narcan training with you and give you, like, a quick primer, but we do not offer any official classes for Narcan.
Thank you.
Britton, do you have?
That's a really interesting question, though. We do have someone in the Access Department who could potentially do the Narcan training. She has a slideshow that she uses for our team and other teams within the organization. So if it's someone from another behavioral health agency wanting to work with us on that, I think I would love to talk about that.
Okay, absolutely. I'm so sorry.
Thank you so much. Thank you for all the work you're doing in the community. My question is around languages. How many languages do you speak? Do you have translation? And if not in-house, do you have any strategic partnerships to kind of cater to our diverse, community?
You want to take this one first?
Yeah, so we do work with a lot of translators. Recently, we also had an ASL translator coming through. Medicaid generally will pay for a translator. Other insurances, we do have to partner with an outside agency, but it is something we're very well versed in and happy to help coordinate.
Yeah. And on a more like I can kind of say like a bit of an informal basis, we actively encourage our staff members, if you are fluent or if you are like confident in your abilities to use either your native language or a learned language in your work, like please don't hesitate to do so. And I will say that we actively encourage that. So if we have someone who is a Spanish-speaking therapist and they have a client who's like, oh, I predominantly like speak Spanish and I have a hard time with English, then we're gonna do our best to try to pair folks with someone that they can actively work with. And we do actively encourage our staff members, like if you know it, please utilize it. And we compensate them accordingly for that.
This is actually a question for both of y'all. Basically, how can the people in this room and online support the work that you do? How do we participate?
You want to take, yeah?
Why don't you go first?
Oh. So, okay, if someone wants to support us monetarily, of course, we will always welcome that. You know, if you would like to make a donation, there's like ways that you can do so over on our website. We also have a wish list where we have like regularly put like items there, like diapers and stuff like that. So that's one way of supporting us as well. But I'm gonna go back to what I said earlier. Let people know that we are here. And let them know that we are welcoming and we're here to support them. Like that is the number one way that you can help us, by helping us help others in our communities who need our services.
I want to piggyback on something you said earlier. It made me think about the importance of stigma and how much it plays a role in people not accessing help that is available to them. Thank you also for bringing up the fact that you went to therapy and you had a wonderful experience and it helped your relationship. I go to therapy because this is a very challenging job and I don't want to have nightmares. I encourage all of my police officers that I work with to see a therapist because the rates of burnout and depression and isolation are terrible when you're in the helping profession. So everything that makes mental health providers seem less scary, it's not because there's something broken and wrong with you. You are not a damaged individual necessarily, just because you decided you're ready to get some help and talk to somebody. So reducing stigma is always my number one answer to how to help, is spread the word. You know, see a therapist, especially men. I'm gonna say men have a harder time maybe with the vulnerability and recognizing like, we need to talk to therapists. As far as financially goes, this program, RACER, is funded by the city councils of 5 municipalities from Kirkland to Shoreline. So we do not have to bill Medicaid for our services. We're not considered medical providers in that same way. To support the existence of programs like RACER, I would say try to get involved with whatever your local city council is and make sure that they hear that you like seeing these services, you want the city council to continue to prioritize this kind of mental health co-response.
It's a great response.
Okay, I want us to please give a hand to Ara and Britton, Center for Human Services, and I want to encourage everyone in the room to please stay here because we're not done, and I'm sorry to go over time-wise. I've done a terrible job of monitoring our time this evening, but I want to welcome Isis and Gabriel up to the stage because we have an important testimonial and powerful story to close us out, so please stick with us.
I'm so sorry for the folks online and the folks in the room. My name is Isis Lara. I'm the Isis Lara Fernandez. I'm the Equity and Social Justice Coordinator. The mic's right behind you. I'm just here to introduce Gabriel. I met him actually this month out in community because that's mostly my job. He's a very active member of Shoreline, and he's actually someone with lived experience. So he's going to share a very vulnerable part of himself, and if you don't mind, please give him the respect that he needs for this portion of the time. So he's our special guest tonight. Gabriel, take it away.
Hello, everybody. First, I'd like to say both of those groups that I heard are amazing, and thank you. And so I could, right now, currently, I am a student at the University of Washington studying pre-law, but it wasn't always like that. October 19th, 2021, I was walking up by the Muckleshoot Casino, and I got hit by a car. I died, my ribs broke, one punctured my lung, one punctured my kidney, 10 broken bones in my face, traumatic brain injury. You guys see my friend right here, my left leg, and I also was in a coma for 2 months. But prior to that, that night, I thank the law enforcement in this state and the officers in the room and the ones watching. But that night, the Lord used an officer to talk to me for about 10 to 15 minutes before the ambulance came. And I died in the ambulance, but I thank Auburn Police and Shoreline Police. So I was the guy that you guys see out there that's going like this. I was on fentanyl, meth, and alcohol. I was a thief. I stole from probably every store in the state. And that was a bad time in my life. I was also tormented by demonic voices. I heard things. They told me to do things. I was laughed at, all those things. But Jesus saved my life. And currently, right now, what we do, the Healing the Hearts ministry, is we go out and love on people, just like you said, to sit on the curb. I just hugged probably 10 or 20 homeless people right now. I just left Everett. We go to the worst neighborhoods in the state. And we're right over here on 143rd, right behind the Kid Valley. I'm sure everybody's familiar with that area right now. It's pretty bad. So what we do is we go out and love on people. We feed them because we can't tell them about God on an empty stomach, we like to say. And then the next step is we don't only do that. Right there at that moment, if they're ready, I'm driving you to detox and treatment. Somebody else in the team is driving you to detox and treatment. You're going to get phone numbers right after. Somebody you can call and support you. And that's where I feel like, because like you said, when the police pull up, there's walls put up. And that's where I feel like we could partner or something could happen, but that's what we like to do. And I think the main reason I'm here is just to show everybody to continue to do what you're doing, because I am the end outcome. And I didn't deserve this. God saved my life. I didn't deserve it. I was a thief back in my old life. I was an alcoholic. I was a drug addict. I did the most. But Jesus saved my life, and now I'm going to be an attorney. Coming up in about 2.5 years, I would say, as long as I go to summer school, right? So I think the main point is just you guys get to see of all that everybody's doing out there, the outcome. You know what I mean? Of the guy who's like this. Or the guy who's swearing and cussing and talking to himself. At least that's what people think, But really, I was under psychosis and all those things. And I know everybody wants to get home, but if I could just leave one last image in your head. God loves us all, and he also loves those people out there the same way. just like we love our daughters, our husbands, our wives. He loves everybody the same exact way. Nobody better than anybody. And nothing happens for coincidence, and I think that's why I'm here right now, just to show you that those same people, that we got such a bad image in our head, this can be the outcome. A little weight I need to lose, but I think I'm doing pretty good with my life right now, you know? And thank you to the officers and the law enforcement and the ones who show up on the scene also, because I know it's tough for you guys. You guys don't get to share a lot of the stuff you see, you know, with family and friends, but you guys got to go through it. So I just want to say thank everybody for listening. And just remember, when you see those guys, that was me, but this is a possibility. Everybody have a good night.
Gabriel, thank you. Thank you so much for sharing your story. We got a lot of love reactions and people giving you love in the chat on Zoom. That was really powerful. Okay, with that, we're going to wrap up for the evening. And reminder that we're going to be back in this room on the fourth Thursday of February, the 26th. We're going to be focusing on the issue of homelessness. So if that's something that, you know, an issue area that you're interested in discussing, please come back and join us. Join us online or in the room, because you're always welcome here. With that, I'm going to bid the folks online adieu. And we are going to close up shop for the evening. So thank you all so much. Thank you to all our presenters. Thanks for hanging with us, too, a little later.